Very good evening. Welcome you all to the certificate course in infertility counseling, batch 7. First of all, I just want to brief you about Manas and then we will go into the details. So, Manas, the Academy of Psychology, which was established in 2020 year, and this is the platform where we can share our knowledge through different online courses, and we do also provide counseling services too across the globe through online and offline in certain places like Vishakhapatnam, Rajahmundry, and Hyderabad. And the main aim of the Manas is to share the knowledge and educate the people in the area of psychology, and especially expertise people in the field of psychology and exclusively in counseling and other related areas like clinical psychology, psychometrics, and all. I am the director of this Manas, the Academy of Psychology, and we do have a coordinator. His name is Rakesh. We have a panel of experts like Dr. Pushpa Raghaveni, Dr. Rajashekar, and other Dr. Venugopal and all. So all these are having more than 15 years of experience in the field of psychology. I just want to tell you about Manas. Manas is always there to help the people, to train them, support them, and mentor the people. The infertility counseling is the unique course which was offered only by the Manas. So I proudly saying that this is our 7th batch of infertility counseling, and maybe even if you can search in Google or any other platform, it is very difficult to find certificate course in infertility counseling, because we people designed this course first time in India, and with the help of Dr. Pushpa Raghaveni, more than 25% people are placed in different infertility counseling centers, even Bangalore, Hyderabad, and some of our students are from other countries. I mean, there are some people from US, and last time one Vietnam and one Philippines. Even this batch also one is from Maldives. Now officially, I welcome you all into the board of the Academy of Psychology, and this course was taken care by Dr. Pushpa Raghaveni, and she is a infertility counselor, counseling psychologist, or clinical psychologist from Hyderabad, and she worked for infertility counseling from last 19 years. I can say she is the first counselor in infertility. I think she started her career from Cloud9 hospitals, and after that she has trained n number of people in the area of infertility. And in recent days she used to work with the Isha Infertility Counseling Hyderabad, and now she is a individual practitioner, and she started her own venture called Open Up with Dr. Pushpa. And I can say she is the right person to deliver this course. And I mean, apart from this, she is my classmate, and we both studied in Andhra University. Initial days also, she is very much passionate about the counseling. That is the reason she trained in CCC Vellore under the guidance of Dr. Prashantham. So that I think that changes a lot her views and orientation and all. Due to because of some reasons, I came to profession of academics, and she is in still counseling. But I do counseling, but more into the academics. I'm a professor of psychology from Adhikavanana University. This is briefly about Pushpa. Now I'm handovering to Pushpa, and welcome Pushpa. Please.
Thank you,
It's
Narayana,
your
for
turn.
the brief introduction. Hi, everyone. He has already given most of my introduction, so there's nothing for me to tell you about me. But this course, I want you people to be as interactive as possible. I think that's my teaching style. I am not a person who would just read what is there in PPT, and what is there in PPT is nothing that I would actually talk. That is just a outline that I have. But we'll be talking more on real-time cases, how to deal with it. But the more doubts you ask, the more interactive you become. I can bring my real-time experience into the picture. If you want to learn and really help people in infertility and you want to gain jobs and or start your own practice in this, I want you to interact more and keep asking, because whatever is there in the PPT, it will be a very superficial thing. But we can go more in depth, more in discussion only when you bring it up. Sometimes one question of you might bring different aspects of what happens in reality. Sometimes theory doesn't actually work, practicality actually works, right? That's what you must have realized also. What you studied in PG to what actually happens in the real counseling session changes everything, right? So I want you people to stop me, ask me as many questions as you can. You will understand my patience level is too much. I would really love to have interactions and talk more. But today I'm not going to go deep into the subject. I'm just going to touch the overlay. So this course is like 30 hours of theory is what we are thinking. But then most of the time, more than theory, we'll have more of one-to-one conversation of real-time cases. We will discuss if in case you have any doubts, or I can bring up my own cases also and we'll keep discussing. So it is more of practical approach rather than just theoretical thing. So we will give you some case studies and some assignments for you to do. And I want you to do those assignments and keep submitting on time. And
Yeah.
Manas you will have performance letter again based on how you are performing throughout the course. You'll be given a certification on that. So
Yeah,
make sure
don't worry about the assignments. It's I mean,
they're
very
simple assignments.
simple and minimal. And
Yeah.
sometimes she asks you to watch movies and all,
Yeah.
so you can enjoy the assignments also.
Yeah. You will enjoy the assignments. Not gonna be like back to school kind.
Yeah,
You will enjoy, but from that assignments also, I want you people to learn things. So couple of movies on infertility kind of stuff we'll be watching on them, and we can discuss about those movies and different perceptions on it,
yeah,
so that we'll be able to understand more on how to help the clients. Okay. Yeah, so we will just quickly go through what kind of module I'm going to cover in this. Maybe if in case you want me to add something else, you can always tell me. So because it's an infertility course and mostly medical things, before you understand to go through what to talk to patient and the psychological aspects, I want you to first understand the biology of it. So we'll talk about reproductive system, male and female, and we will also talk about psychology of infertility, because from where it started, how it started, and why it is important to consider their emotions. We'll discuss on that. Being diagnosed with infertility, what kind of emotional aspects it brings to them. There are so many people who are already there. I think there's one doctor who is already working in the hospital. So if in case you understand diagnosis, how much it will bring stress to them, you will be able to retain your patients to your own hospital, so that your revenue also increases, and your patients also will feel good that somebody is addressing their emotions. So mainly when they're diagnosed for the first time, a lot of people lose their patience when they're diagnosed, because it's very important to tap on their emotions there. Okay, and how counseling helps fertility patients. We will discuss on that. Who need counseling and whom you should address. And we'll also discuss on a role of a physician in counseling and the relationship of other staff. Like it's not only that you and your patient only will have an introductions, but there are other staff members also in the hospital who can contribute to helping you to give some kind of information. So we'll see how other people can play a role there. And what does your hospital or management expect you being a counselor, and how can you handle it in a tactful way rather than uh, uncomfortable situations? And you'll understand all the ART procedures like ovulation induction, IOI, IVF, ICSI, TISA, PGS, PGT. I'll talk about every procedure possible. And if you don't understand the procedure, you'll not understand when patient talks to you about being anxious while taking injections, being anxious while going to the pickup. Unless and until you understand the terminology, you'll not be able to be available to the patient who is going to the medical procedure. So you need to know this. This is called psychoeducation. So I will train you on that as well. And how do they feel during their ART procedures, and the impact on the relationship, because most of the time they come as a couple together, and when they're coming as a couple, if there is any kind of clashes or uncomfortability, then that will add to more and more issues for them. So how how it impacts on the marital aspects, couple communication, everything, we will start working on that as well. And gender differences in handling infertility, because not both male and female respond to stresses in the same way. They have their own ways of handling it, and on top of it, when they have this pressure of wanting to have a baby, so I need to prove to the society that I can be a mother, I can be a father. How can that gender differences impact on their treatment plus on the relationships? That also we'll discuss. And psychosocial evaluation, we need to, because we need to have proper history taking, and also I'll give you what kind of questions you can ask, how do you start your therapies as well. And not only basic counseling, we'll also go into deeper therapies like psychotherapies. If you have to give, some patients might come with anxiety, some patients might have fear because they have already had three miscarriages, and they don't know, they're scared, or the phobia has started for them with the trauma that they had with the miscarriages. And if they had an ectopic pregnancy, that is even more traumatic for them, and they'll not be able to handle. So at such cases, you will have to do therapies for them. So we will see how we can do those therapies as well. And how do you do individual counseling? Because most of the time, females or males, they try wanting to talk separately rather than with couple together. And we'll also do couple therapies properly, couple counselings. I'll teach you how to do support group sessions in your hospital if you want to do some support group or group therapies with a lot of patients together. That also will cover. And sexual counseling, there'll be a lot of patients who will have um premature ejaculation problems. There are women who are scared of vaginal penetrations. So there'll be a lot of sexual problems. Sometimes people think, why should I even go through uh, the sexual part? It is so difficult for society. Let me just go to a fertility center and get a scanning done, or get a IUI done or IVF done. I'll be pregnant. But after coming there, only people will realize even that is done through their private parts, and they have to overcome that fear to get an IVF or IUI done. Then if you're not able to do sexual counseling, then it will become a drawback for you there. So I will teach you how to do sexual therapies as well. And counseling for pregnancy loss, if in case they have multiple pregnancies, like you see in news a lot of times, like two pregnancies, three pregnancies. So if multiple pregnancy happen, how do you counsel them to help them to overcome that stress? Third party reproductions like surrogacy, or they're taking a donor egg or a donor sperm, those kind of things. And what kind of how to do assessment if the donor or the surrogate is right or not, because now there is a new protocol or new rule that psychologist has to do assessments to them. So how do we do, what kind of assessments we do, we'll work on that as well. And alternative family building, if in case they decided ki no, none of this treatment is working for me, and this has become very expensive for me and I'll not be able to handle it, then we can start if in case they're planning to go for an adoption. So suddenly from infertility to adoption, that shift is not easy for them to accept, and for them to let go of the grief that, okay, I cannot be pregnant anymore with my own genetics, I cannot have my own genetical baby, but I'm going for an adoption. That shift, you need to prepare them and make them process that. So from that to they deciding not to have a child. Now there are so many people who are deciding ki, I don't want to have a baby. Maybe I will travel around the world, or I will adopt a dog. I'll adopt something. So there's so many people who will come and talk to you like that. So if that is the case, as a therapist, our role is not to teach them ethics, or no, not to tell them ki, this is right and that is wrong. But if that is the choice of choosing not to have a baby, let's respect that. And we should know how to make them process that so that they don't regret about it later. So that part also we will cover here. And if they're planning to end the treatment completely, like I don't want any treatment, but I want to pause this, or I'll end this, I don't know. Even ending the treatment. So if in case you are sending a patient from your hospital, while they're leaving also with a lot of respect, the patients will come back to you again. They might refer a lot of people to you. So you're still sending them with a positive vibe of, we tried, we gave 100% best, it did not work. So ending of the treatment counseling is very important, because they should not go with a disappointment ki nothing is working in my life. So it's important to work on that. We'll work on that. We will discuss on that as well. And we will also work on pregnancy after infertility. Like throughout the infertility treatment, they have already struggled so much. And lot of clients I see that patients keep telling me, I can't believe I'm pregnant and now I don't know what to do. And now I'm scared again. I'm pregnant, but I'm scared. What if I get miscarriage? What if I have some problem? So 9 months will be like anxiety for them. They're anxious because this pregnancy is so precious. We tried so much, we struggled so much, and finally I'm pregnant. And now when I'm pregnant, I am not able to enjoy this, is what a lot of clients tell me. They'll be like, I wanted this pregnancy so badly. I'm finally pregnant, but I'm not able to enjoy. I'm constantly in that anxiety. So I will work on how to help those patients who are feeling anxiety. And you can also extend your counseling for post delivery, once they become pregnant. Infertility patients and parenting is always interlinked, because this patients always will give too much to the child, and parenting boundaries, or they'll give too much lenience to the kids, because out of so much struggle this baby came, and they'll be thinking, oh, I have to give 100% to this child. But there are chances the child will misuse that
Freedom.
parenting aspects. So it is important for you to learn parenting after infertility also. How do they transit and now accept the fact and now start becoming like a parent and letting go of all the struggle that they have gone through. So that also we will discuss on that. And how this ART treatment will impact on the child psychologically, not because of the procedure, but because of the stigma that they have gone through. Because a lot of times parents will have that stigma. Oh my God, I have gone through this. I've gone through IVF. I don't want this to be known to anybody. They are already holding the stigma, and they will spread the same stigma to others also, right? So that part we will also work. And ethical and legal aspects of counseling also, we will discuss on. And if there are any patients who come to you like they're lesbians or they're single women, gays or a single man is not allowed for the treatment. Women are allowed to go through an IVF treatment. So if in case they have this counseling like lesbian couple or single women ka thing, then that is gonna help. That also will work, and also we'll do a lot of case studies, and we'll also have an exam. Exam is like not writing 3 hours of exam, but I'll be giving you cases, and I want you to solve and tell me how will you solve those cases. Okay, so this is gonna be the course module. If there is anything else, you can always ask me in between, and we can add up while discussing on specific modules.
Thank
Okay.
you, Pushpa. Thank you. Have a great day and good night.